Hey class, for my multimedia discussion post, I decided to focus on the retail industry and more specifically medicinal and aromatic plants or MAPs. The Journal of Agricultural and Food Research, JAFR, describes medicinal and aromatic plants as essential natural resources with applications in pharmaceuticals, foods, cosmetics, and pesticides. And that was an article by Zamani in 2025. And while in the United States it might seem alternative, worldwide 80% of the population in the 170 WHO member states use traditional practices such as herbal medicines, and that's from that same article. And here's a cool import-export map of the globe that I found, and the market for MAPs was estimated to be worth 4.25 billion in 2023, with China and India emerging as key exporters, and that surged 98% since 2010, and it's the 976th most traded product globally. China being the top exporter and the United States being the top importer of these materials from that same article. Furthermore, data from the International Trade Center shows that world trade in MAP resources is expected to grow annually at a rate of 10 to 12%, an article by Devi et al. In 2024. Another paper I found analyzed the Indian MAP supply chain, and that's about 8% of the global market. And it asserts that they're an important part of many sections of the global economic market, and these include the Asian traditional medicinal practice, and so that's 7 different sections, and with those, they have roots back thousands of years, so a well-established market. The supply system that's similar in every other country that has a high load, just like India, so like China. This encompasses many stakeholders and influences. And then another diagram from that paper by Sharma that gives a visual representation of the value chain for MAPs. And it's great because this diagram highlights the areas where hiccups can occur within the supply chain at any of the transition points. Most notably, MAPs are raw materials, but also are transformed into products via manufacturing. So, 40% of modern pharmaceutical products, including aspirin and childhood cancer treatments, are derived from natural sources and traditional knowledge. And that's the same article by Zamani, 2025. Robert Marriott, representing the American Herbal Products Association, told Rachel French in a 2025 interview that China is also a major and often exclusive source of particular botanicals, which cannot be viably produced at price or potency outside of that country. He goes on to say that in many fields, there are no alternatives. Corey Shaw is the VP at Jia Herb, states that their company accesses 80% of their 2,000 products from sources in China. In that same interview by French. Because of the nature of the raw materials, this leaves the industry open to many vulnerabilities. The most recent and noteworthy has been the unpredictable geopolitical climate around international trading. Dan Richard is the VP of Global Sales and Marketing at Now Health Group, predicts that higher tariffs will lead to higher prices for consumers this year in that interview from 2025. Marta Wanska, PhD, she's a senior fellow at the Center on Health Policy, states that many of the drugs on the ASPR list of 86 are at high risk of shortage. So this is in reference to pharmaceuticals. So 86 of the most used ones are at high risk of shortage, and then 40% of those are going to be made from those MAPs that we're talking about. And she also states that although no drug shortages in the last 20 years appear to have been caused by export restrictions, COVID-19 created some close calls, reminding policymakers across the globe that geopolitics could lead to supply disruptions. And then another analysis from late 2025 done by 2 attorneys that specialize in international trade law, Melissa M. Brewer and Matthew T. Martin from Georgetown University, warned that U.S. companies should monitor developments, understand the changing trade rules, compliance obligations, and the applicability to their operations, and identify ways to leverage opportunities for advocacy and engagement in reference to the ongoing tariff issues. And the most recent changes were just in September of 2025, but stuff could change again at any time. And some other less notable problems with the supply chain for MAPs and their related supplements and medications is potential contamination. An article from the American Medical Association Journal of Ethics states that the FDA inspected 656 dietary supplement production facilities in 2017 and found violation in more than half of them. And the most common violation being failure to establish purity, strength, or composition of their final product. And that was by Cadwallader in 2022. So, due to lack of regulation and oversight, this is really common. Basically, it's saying that the stuff they were producing wasn't said, they weren't actually producing what they said they were. And a citizen scientist, even by the name of Lead Safe Mama, she's actually out of Portland, has found dozens of supplements to be contaminated with heavy metals like cadmium, lead, and arsenic. And she crowdsources funds to have these products tested in an independent and third-party lab. And I got that information from her website. Another threat to the supply chain in this environmental is environmental and sustainability. Conservation really needs to be a topic of discussion when these botanical treasures face threats from overexploitation, inappropriate harvesting, and utilization due to the consistent and specialized need of the plant material. That article from Devi in 2024. Robert Marriott, again, explains in his interview with French that you're sometimes dealing with plant parts that can only be harvested from a mature plant of a tree that takes several years to reach a harvestable stage. And the basic reality of the time it takes nature to produce versus our need is increasing too fast to keep up with those sustainable practices. A solution I thought about to all of these problems is to transition from overseas to domestic production of MAPs. Wilson Lau, CEO of New Herbs, said, if you could have grown it here or another country that's a little more trade friendly to the United States, there were probably some opportunities to it, he said to French in that 2025 interview. And in my opinion, most of these issues could be fixed by moving production to the United States. It won't be cheap, easy, seamless, obviously, but it seems like the economic solution to a big issue. Inconsistent trade requirements and tariffs are unpredictable, and ultimately that will fall to the consumer to cover, and that makes the market unpredictable and unstable. Environmental sustainability is in question because of an entire global market of MAPs being grown in one location over and over again, monocropping, instead of locally on a smaller scale with rotation. This could clear up manufacturing issues. If local clinics and pharmacies had their own production facilities with the raw materials growing nearby, it could streamline the process and allow for higher quality, small batch medicinal products. This, in conjugation with evidence that indigenous food forests sustain a biologically diverse ecosystem long after tending when compared to a monocrop agriculture, this seems like the economic and scientific way forward and environmental way forward. All of this evidence, along with my own personal experience of growing, harvesting, and wildcrafting using medicinal plants while living in various climates, all on the west coast of the United States, I could see this being a viable and long term solution. And thank you guys for listening to everything I had to say. I hope you learned something about the global market around medicinal and aromatic plants.